The tibialis anterior is one of four muscles in the anterior compartment of the leg. It attaches proximally to the proximal 2/3 of the tibia and is palpable just lateral to the shaft of the tibia. It runs distally from there and becomes a very prominent tendon here, and then it continues to attach to the medial side of the foot. To engage this muscle so that it pops out, we ask the client to do its two actions, which are dorsiflexion of the foot at the ankle joint and inversion of the foot at the subtalar joint. And we immediately see the distal tendon become visible. We can also add resistance to these actions so that the muscle will contract even more. And as he engages the muscle, we can strum perpendicularly across the muscle in baby steps, palpating from proximal toward the distal end of the muscle. The client alternately contracts and relaxes, and we continue palpating when the client contracts. In the distal leg, the tibialis anterior narrows down and eventually becomes a tendon right at the ankle region approximately here. This tendon is easily palpable and can be followed to the first metatarsal and first cuneiform on the medial side of the foot, right here. Now that we've palpated the tibialis anterior distally, let's go back up to the belly, and with the client contracting against resistance, we will now start to palpate this muscle proximally. The client will alternately contract and relax the muscle, and we will strum across it perpendicularly in baby steps toward the proximal attachment, which is all the way up on the lateral tibial condyle. To discern the lateral border of the tibialis anterior from the adjacent extensor digitorum longus, we use inversion and eversion of the foot. The tibialis anterior is an inverter, and the extensor digitorum longus is an everter. So if we ask the client to evert the foot, the extensor digitorum longus contracts, and the tibialis anterior stays soft. If we ask the client to invert the foot, the tibialis anterior contracts and the extensor digitorum longus remains relaxed and soft. So by using inversion and eversion, we can discern the border between the tibialis anterior and extensor digitorum longus.